Tom?
Just given that you're in
I'll answer. Yeah.
naive patients.
Given your trials in lenalidomide naive patients, are those hard to find now? I mean, they would all be getting the drug off-label, right? And it's expensive drug. So is that a big factor, or is that a non-issue?
Dr. Raza?
I don't think in general right now, for me at least, it's a big issue. We can find those patients, and I do think that once the drug gets approved, then everyone will be using this up front. It's not like we happily use lenalidomide or HMAs in that group.
Just the concept of holding doses with this drug, and the idea that you need to fight through the urge to hold doses, there's been some discussion about that, about people living off diseased clones and stuff like that. Can you talk a little bit about where that stands in your mind?
I mean, that's an issue with every drug that we use in cancer. Lower risk MDS, from day one of diagnosis, we start having a conversation with the patient that this is a chronic disease. You will live with this disease and probably not die from it for a long time. But living with it can be taxing and can be a problem for the quality of your life. And when they become transfusion dependent, the important thing is to see whether treatment is posing more of an issue for their quality of life than just coming every 2 weeks to get a blood transfusion. Now, the other thing with blood transfusions is it can lead to iron overload, and we start running into those problems. So those are the reasons why we want to treat the patient. But I'm very cognizant of this notion of not making their quality of life worse than it was already with transfusions. So if myelosuppression is going to do that, then sure, we'll worry about not using it. But I haven't seen that happen. I mean, my personal experience with the drug has not been intense myelosuppression at all. It's reversible, it's manageable, it's something we see with hypomethylating agents, something we see with lenalidomide. In fact, to me, it's less than with some of those agents.
Thanks. Other questions? Other questions for either of us? I'm happy to answer any from the company point of view as well. Well, I think